Hello, I'm Margaret. We're doing our extra credit for the mental health test and doing a review of our questions and the answers.
Hey, I'm Tara Devereaux.
Hey, I'm Shuntavius.
I'm Shundra T.
Mariah H.
Okay, we're going to start off by speaking about the anticipating medications used to treat hyperactivity, impulsivity, and inattentiveness. This belongs to a group of medications called stimulants, which work by increasing activity in the brain, particularly in areas that play a role in controlling attention and behavior activity.
Various medications are used to manage behavioral disorders in children and adolescents. Parents should understand that pharmacological management is most effective when accompanied by techniques to modify behaviors.
The brand name of methylphenidate is Concerta. Dextroamphetamine is a controlled substance. It can cause rapid or irregular heartbeat, delirium, panic, psychosis, and heart failure. Next, some expected findings of alcohol withdrawal. The manifestations usually start within 4 to 12 hours from the last intake of alcohol and can continue 5 to 7 days.
Common manifestations include nausea and vomiting, tremor, restlessness, and ability to sleep, depressed mood or irritability to sleep. It can also increase your heart rate, blood pressure, respiratory temperature, and can cause seizures.
Manifestations also include severe disorientation, psychotic effects such as hallucinations, severe hypertension, and cardiac dysrhythmus. This type of withdrawal can progress to death.
Aggressive communications, in addition to nonverbal characteristics, were also emphasized, such as pushing, hitting, slapping.
Described as expressing your feelings and opinion strongly as they occur. Can also be manipulative strategy as guilt tripping, putting others down, shouting at others, yelling, being demanding, and blaming others.
Next.
Anticipating medications for alcohol withdrawal. Dysphorium is a daily oral medication that is a type of aversion behavior therapy. Dysphorium used concurrently with alcohol will cause acetaldehyde syndrome to occur. Effects include nausea, vomiting, weakness, sweating, palpitations, and hypotension. Adjunct medications such as carbamazepine, clonidine, propranolol, and atenolol.
Naltrexone is a pure alcohol that suppresses the craving and pleasurable effects of alcohol. Assess the patient history to determine the client depending on opioids. Suggest monthly IM injection and take medication with food to decrease GI distress.
Anticipating medications used to treat bipolar disorders. Expected pharmacological action is lithium, produces neurochemical changes in the brain, including serotonin receptive blockage. Anti-epileptic medications help treat and manage bipolar disorders through various mechanisms.
Tegretol is also one of the meds that are used to handle bipolar disorders. Barriers. Go ahead.
Identifying barriers to effective communication.
Asking irrelevant personal questions, giving advice, offering personal opinions are all barriers to effective communications.
Giving false reassurance, minimizing feelings, and changing the topic.
cultural barriers, diversity barriers, perception, and using technical jargon.
Rapid questioning, giving approval or disapproval.
Identifying contributing factors to the development of a mental health disorder. Adverse childhood experiences.
A history of mental illness in the blood relatives, such as a parent or a sibling. Deinstitutionalization and criminalization.
The client's stress level, their coping abilities, support systems.
Passive communicator. Not expressing feelings or needs, ignoring your own personal rights and allowing others to do so, deferring to others for decision making, avoid tension and conflict.
Also, it can be avoid expressing their opinions, needs, or values. Some examples are saying, here we go again. I guess there's nothing I can do about it. Frequent apologizing while asking for something they need.
A style which you avoid directly saying what you think or want, and that often involves uncomfortable body language. An example of that would be, I'm okay with whatever y'all want to do.
The role of acetylcholine in Alzheimer's diseases. Cholinergic medications increases acetylcholine by inhibiting its breakdown, which increases the availability of acetylcholine neurotransmitters, receptor sites in the central nervous system.
Acetylcholine is a neurotransmitter that plays a role in memory, learning, attention, arousal, and involuntary muscle movements.
Presenting information about histamine. The known postsynaptic receptors for histamine in the brain mediate the effects of alertness and wakefulness.
Can you give me my paper? I have this to move down. The yellow one too. But yeah, thank you. Okay, hold on a minute, 'cause I wrote all over. Okay, maybe I didn't do that. Histamines are chemicals your immune system releases, mainly known for its role in causing allergy symptoms.
This concludes our extra credit for our points from the review from the test that we did not do so well on.
Thanks.
Thank you.
Thank you.